If you want the penis to work at 100% for the rest of your life, you need to watch this video. I'm Dr. Arkady, men's health specialist, and today I'm sharing 10 things that will completely change how you think about the penis health. Most guys honestly have no clue about these. And number 7, but it could be destroying your erection right now. Quick favor to ask you before we jump in. Please hit the subscribe button. Only 15% of you watching this video right now actually subscribed. And I put out content like this all the time to help you guys optimize your health. Let's jump right in. Number 1, track your morning woods. This is literally your penis check engine light. Every night while you sleep, your body gives you 3 to 5 automatic erections that last about 20 to 30 minutes each. Now, this is not having sexual dreams or anything like that. This is a pure maintenance. Your penis has spongy erectile tissue inside that needs the fresh oxygenated blood pumping through it regularly to stay healthy. And this nighttime erections are what prevents the scar tissue from building up and keeps everything elastic and functional. Here's why this matters so much. If you stop getting the morning erections, something is wrong. And this is actually how we diagnosed erectile dysfunction in my practice. Let me break it down for you. If you're having trouble getting hard with your partner, but you're still waking up rock solid in the morning, that's usually indication of a psychological stress, anxiety, relationship issue. Your plumbing works just fine. But if you're not getting the morning wood for weeks or months at a time, that's physical. It could be a blood flow issue, could be hormonal balance, or something else could be happening in your body that needs attention. Here's the statistics that drives it home. 75% of erectile dysfunction causes have an underlying physical issues. It's not all in your head like most of the guys assume. I had a 42 years old patient who came in because he was struggling with his wife and he was convinced it was just stress from work. I asked him about his morning erections and he said, actually, now that I'm thinking about it, I haven't had one in months. That changes the entire diagnosis. We dug deeper and we found the cardiovascular issue he had no idea he had. So please pay attention to this. If your morning wood disappears, that's your body sending you a message. See a doctor. This is your body's warning system and you don't want to ignore it. Number 2, work on your pelvic floor muscles. Yes, guys can do Kegels and they're absolute game changers for a lot of guys. Your pelvic floor muscles do 3 critical things. They help you to hold the urine, they pump the blood into your penis during the erection, literally squeezing it in there to make you hard, and they control your ejaculation. And when these muscles get too weak, then you end up with softer erection, premature ejaculation, and much weaker orgasms. There was a British study that found that 40% of men who did pelvic floor exercise for 6 months completely resolved their erectile dysfunction. Yes, not improved it, resolved it. No pills, no injection, just exercises. One of my patients, 38 years old, was losing the hardness during sex and everything tested normal. Testosterone, perfect. Blood flow was okay. Nothing obviously wrong. So I taught him proper pelvic floor exercises. And 6 weeks later, he came back and said that it was a night and day. His erections were harder, they lasted significantly longer, and he felt like he had total control. Next time you're urinating, try to stop the flow midstream. Don't actually do the exercise as you urinate, but pay attention to the feeling that you get. The feeling in the perineum when you have to contract that perineal muscle. Don't actually do it regularly as you urinate because it's bad for your bladder, but do it once to just identify which muscles you are feeling control of. You'll be feeling kind of a pulling, tightening sensation. Those are your pelvic floor muscles. Now, once you know what they feel like, you can do these exercises anywhere. Contract the muscles, hold it for 5 seconds, then relax them, and keep on relaxing for about 10 to 15 seconds. That's 1 rep. Do 10 reps 3 times a day. You can do this sitting down at your desk, driving in your car, watching TV. Nobody knows it, but you're doing your exercises. Start today and give it at least 4 to 6 weeks before you judge the results. This actually works. Number 3, watch your waistline, because the belly fat is literally an estrogen factory wrapping around your waist. Here's what most guys don't understand. That tissue isn't just sitting there doing nothing. It actually produces an enzyme called aromatase, and this enzyme takes testosterone and converts it into estrogen. So the more belly fat you have, the more testosterone you're converting into estrogen, which means you're literally feminizing your body. Study shows that for every 1 point increase in BMI, testosterone drops about 2%. So if you have 30 points overweight, that could mean a 10 to 20% testosterone drop, and low testosterone directly causes erectile dysfunction. But it actually gets even worse than that. Belly fat causes a chronic inflammation that damages your blood vessels, including the ones that are necessary for your penis. I recently had a patient who came in at 260 pounds complaining of erectile dysfunction. And I told him, look, before we start any treatment or any medication, I need you to lose about 30 pounds and come back. Quite honestly, he was pissed. He thought I'm just trying to blow him off. But 6 months later, he came back at 230 pounds and said, Doc, I don't need the pills anymore. Everything started working again. His testosterone had jumped 150 points just from losing the weight. So here's what I want you to do. Measure your waist right at the belly button. If it's over 40 inches, it's a red flag for erectile dysfunction risk. If you're over 37 inches, you're in a danger zone. Your goal should be to get under 35 inches, if it's possible. Now, keep on sticking around, because number 7 is the one that nobody expects. It could be killing your erection right now, and you probably have no idea about this. Number 4, get your hormones checked. If you're over the age of 30 and you do not know your testosterone level, you're basically flying blind. Testosterone men have been dropping for decades. They've been declining about 20% since the 1980s. The average 30 years old man today has a testosterone of 50 years old man 40 years ago. Now, I want you to think about this for a second. Low testosterone doesn't just kill your sex drive. It directly causes erectile dysfunction, even if you still want to have sex. And here's why. Testosterone is necessary for production of nitric oxide in your blood vessels. And nitric oxide is what causes your blood vessels to dilate and allow the blood flow into the penis to create an erection. Low testosterone means low nitric oxide, which means softer erection, even if you are aroused. I see it practically every day in my practice. The guy comes in his 30s with erectile dysfunction and exhaustion. He checks his testosterone and it comes back at around 300. Now, technically, that's normal because reference ranges between 300 and 1000, but he's at rock bottom. A guy in his 30s should be around 600 to 700, even 800. So get tested. Test in the morning when testosterone levels are higher. If your test comes back low and you're having the symptoms, work with your doctor who specializes in men's health to optimize your testosterone. It's that important. And by the way, if you are in New York area and you need help with any of this, erectile dysfunction, low testosterone, premature ejaculation, that's exactly what we do in my practice. You can check us out at edtreatmentny.com. Number 5, limit extended sitting and cycling, because you're literally sitting on a nerve and arteries that feed your penis. When you sit for hours at a time, especially on a hard surface, you're putting direct pressure on the perineum. That's the area between the scrotum and the anus. Running right through that area are the pudendal nerve and pudendal artery, and this controls sensation and blood flow to your penis. Multiple studies on male cyclists shows that men who ride more than 3 hours per week have significantly higher rates of erectile dysfunction and genital numbness compared to runners, swimmers, or any other sport activities, and this dose-dependent. More you ride, the higher the risk. I had a patient who was training for a triathlon and cycled 10 to 12 hours per week. He started noticing that he could not feel much sensation during sexual activity, and then he started having trouble maintaining his erection. Turns out he had developed epidendal nerve compression from all of this biking activities. He had to stop cycling for a while, about 6 weeks, and switch to running and swimming instead. Overall, it took about 3 months, but his sensations came back and his erections normalized. Now, he still cycles, but he uses a softer seat with a cushion and proper shorts to reduce the compression on the perineum. And by the way, he also limits his cycling to about 5 to 6 hours per week maximum. Now, if you, like millions of people, have a desk job and you have to sit for extended period of time, set a timer every 45 minutes when you get up and you walk around for about 5 to 10 minutes. Just get the blood flowing again. And if you're a cyclist, invest in a proper seat so you reduce the compression on your perineum. And please consider mixing up some other form of cardiac exercise instead of just cycling every single day. And we are going to number 6. Fix your sleep, because most of your testosterone is produced while you're sleeping, and sleep apnea is absolute erection killer. Men who sleep less than 5 hours a night have testosterone levels that are about 10 to 15% lower than men who sleep 7 to 8 hours a day. And that's statistics. But here's the bigger issue that most guys don't know about at all: sleep apnea. This is where you stop breathing repeatedly during the nighttime. Your airway collapses and you stop breathing normally for 10 to 20 seconds at a time. Then you stop gasping for air and you wake up slightly before you're falling back asleep, and doing it repeatedly over and over through the night. Your oxygen level drops, your body panics and releases stress hormone, and this damages the blood vessels while you're crushing your testosterone production. A study found that 69% of men with obstructive sleep apnea have erectile dysfunctions. Think about this, nearly 7 out of 10. So if you snore loudly and you wake up gasping for air and choking, get a sleep study done. See a pulmonologist. This could be destroying your penis health and you don't even know about this. And finally, number 7, as promised, mind your dental health. And this is one nobody sees coming. Men with chronic gum disease or periodontitis are 3.3 times more likely to have erectile dysfunction than men with healthy gums. I swear I'm not making this up. Here's why this happens. Gum disease causes chronic inflammation in your body, and when you have infected, inflamed gums, your body isn't constantly releasing inflammatory markers that travel throughout your bloodstream, and they damaging the internal lining of the blood vessels, including those tiny little blood vessels in your penis that are directly responsible for your erection. Plus, the bacteria from infected gums can actually enter the bloodstream every time you brush your teeth or you floss, and this bacteria directly causes the damage to your blood vessel walls as well. It's the same mechanism that links the gum disease to a heart disease and stroke. In fact, men with periodontitis have a 50% higher risk of having a heart attack. Your mouth is not separated from the rest of your body. So do yourself a favor, brush your teeth twice a day and floss every single time you eat. Now, this is not negotiable, and please see your dentist at least every 6 months for cleaning. If you have any signs of gum disease like bleeding gums, red swollen gums, bad breath, get treated immediately. Number 8. Know your numbers, your blood pressure, your cholesterol, your blood sugar level, because your penis is literally a canary in a coal mine for the heart disease. Here's something that potentially can blow your mind. The blood vessels in your penis are tiny, only about 1 to 2 millimeters in diameter. The blood vessels in your heart are much bigger, about 3 to 4 millimeters. So when you start developing cardiovascular disease and your blood vessels start getting clogged with plaque, the the small blood vessels get clogged first, which means your erectile dysfunction often shows up 3 to 5 years before the heart attack sets in. Your penis is literally warning you that something is wrong and you should pay attention. And here's some statistics. 75% of men who had a heart attack actually had an erectile dysfunction in the past. So there are 3 numbers you absolutely need to know. First, your blood pressure should be always under 120 over 80. If you're over 140 over 90, you have hypertension and it's damaging your blood vessels right now. Second, your cholesterol. Your LDLs ideally should be under 100. Your HDLs ideally should be over 40. And your triglycerides should be under 150. High LDLs, bad cholesterol, builds up as a plaque in your blood vessels, which narrows them down, reducing the blood flow. Third, you should know your blood sugar level. Your fasting glucose should be under 100. If it's between 100 and 125, you're pre-diabetic. Over 126, you are diabetic. High blood sugar is absolutely toxic to your blood vessels and nerves. And studies show that 50 to 60% of men with diabetes have erectile dysfunction. Know your numbers. This isn't optional. This is your life you're talking about. Number 9, choose your underwear wisely, because your testicles need to stay cool to produce testosterone and sperm efficiently. Your testicles hang out outside of your body for a very specific reason. They need to be 2 to 4 degrees cooler than your body temperature to produce sperm. When you wear a very tight underwear, especially synthetic material, you're holding your testicles tight against your body, trapping the heat down there. Harvard study found that the men who wore boxers had sperm concentration 25% higher than the men who wore tight briefs. And while the effects on testosterone, direct effects, isn't dramatic, chronic heat exposure to your testicles can affect the cells that produce testosterone over the period of time. So here's my recommendations. Wear breathable cotton boxers. Keep your phone out of your front pocket. And if you have to work with a laptop, don't keep it on your lap. Get a normal desk. The heat from the laptop adds over time and unfortunately reduces the sperm production. And now we're getting to number 10. This one could literally save your life. Be supplement smart, because gas station pills can actually kill you. I see guys all the time who's been taking certain supplements, male enhancement pills they buy at gas stations or bodegas. You know the ones I'm talking about. Rhino, Black Mambo, Rock Hard, whatever ridiculous names they come up with and packaging. They all promise the instant erection, increase in size, and all-night performance, and guys take them without having any idea what they actually taking, what's inside of those pills. Let me be very, very clear about this. These products are dangerous and they are illegal. The FDA has issued over 100 warnings about these products because when they test them, they find hidden pharmacological ingredients, dirty ones, basically unlabeled Viagra or Cialis, sometimes at dangerously high doses. But not only that, you don't know the dose, you don't know what else they mix in there, and if you are taking other medications, particularly blood pressure medications or nitrates for heart disease, mixing this can be deadly. If you actually need help with erectile dysfunction, there are safe FDA-approved medications that works extremely well, like Viagra, Cialis, Levitra. These have been studied in millions of men. But guys don't want to see a doctor because they feel embarrassed, or they rather buy mystery pills from the gas station and literally gamble with their lives. Honestly, I think it's insane. Now, there are also great supplements that I personally recommend to all my patients that actually help. L-citrulline, L-arginine, amino acids that are building blocks for nitric oxide and help to improve your blood flow and improvement of the erection. Zinc and vitamin D are important for testosterone production. If you are deficient of them, you probably also have reduction in your testosterone. If you're not deficient, taking extra wouldn't hurt you anyway. Ginseng has been studied for years and shows some improvement in erectile function as well. The bottom line in this, if you are having erectile problems, see a specialist. Get properly evaluated. Figure out what causes your particular problem. If you need medication, get a real prescription from a real physician who can monitor it safely. Don't gamble with your life over embarrassing conversation. Your penis and your life are worth more than that. If this video helped you, smash the like button and share it with your friends. And if you are not subscribed, please subscribe now so you don't miss future videos.